Imagine finding out that something you do every single day, something you do in complete privacy, something nobody ever taught you to pay attention to, has been sending you a warning signal for months, maybe years, and you have been flushing that signal away without a second thought. Does that sound extreme? Unfortunately, it is not. There is a habit that billions of people share. Every single morning, they go to the bathroom, they do not look, and they flush. And inside that toilet bowl, their body was trying to tell them something urgent, something their doctor has not had the chance to explain, something that, if caught early, is entirely fixable, and if missed, can be devastating. Here is the number that stopped me the moment I first saw it. Colorectal cancer is the second leading cause of cancer death in adults over 60 in the United States, and in more than 60% of those cases, the early warning signs were present, visible, readable, right there for months before the diagnosis. The body was communicating, nobody was listening. In the next 15 minutes, I am going to show you exactly what your body is trying to tell you every single day, which specific changes demand immediate medical attention, and 5 concrete protective steps you can begin tonight. Steps that require no prescriptions, no expensive supplements, and no special equipment. I have spent decades working with patients who ask me afterward, why did nobody tell me this sooner? I am telling you now. Pay attention to what comes next. Before we go any further, I want you to do one thing right now. Drop a comment below with just your age, nothing else. Just the number. I want to see who is watching this, because what I'm about to share applies very differently depending on whether you are 55, 65, or 75. The thresholds matter. The screening timelines are different, and the warning signs carry different weights at different ages. And if you have noticed any of the following in the past few weeks: unexplained fatigue that hits specifically after meals, a vague, uncomfortable pressure in your lower abdomen that comes and goes, or any change in your normal bathroom routine that has lasted more than 7 days, add the word change to your comment. That information matters more than you realize, and you will understand exactly why in about 4 minutes. Here is what is happening in examination rooms across this country every single day. A 67-year-old comes in for a routine annual physical. Blood work looks reasonable. Blood pressure is managed. The doctor runs through the checklist. At the end, he asks, any bowel changes? The patient thinks for a moment, says things seem a little off lately, maybe a bit more constipated than usual. The doctor nods, suggests more fiber and water, and moves on to the next patient. 6 months later, that same person is back, this time with a diagnosis of stage 3 colorectal cancer. The constipation was not just constipation, it was the colon trying to push material past a narrowing that had been quietly developing for 2 years. But because the question was asked in passing and answered in passing, the connection was never made. A colonoscopy that would have taken 30 minutes could have found that narrowing when it was still a small polyp, removable, in the same appointment, no surgery, no chemotherapy. No fear. This scenario is not rare. A 2022 analysis published in the Journal of the American Medical Association found that delayed diagnosis of colorectal cancer, defined as more than 12 months from first symptom to confirmed diagnosis, occurred in 34% of cases. 34%. In 1/3 of cases, the window was there and it was missed. The gap between what the research shows and what is happening in everyday medical practice is costing people years of their lives. And the single most powerful thing that can close that gap is something you can do yourself every morning in under 10 seconds. Understanding what you are looking at. Now, if you are someone who wants to understand the why behind the warning signs, not just be told what to look for, then what I'm about to explain is going to give you a completely different framework for thinking about digestive health. Your colon is not just a disposal system, it is an active living organ with its own muscular walls, its own nerve network, and its own microbial ecosystem. Think of it like a sophisticated manufacturing facility with 3 distinct jobs running simultaneously. It extracts the last nutrients from what passes through. It manages water balance for your entire body, and it houses more than 70% of your immune system. When something goes wrong in that facility, a growth, a narrowing, a disruption in the bacterial workforce, the output changes. The product coming off the line looks different, and that output, which most people immediately discard, is actually the most detailed daily health report your body produces. 3 specific changes happen in the aging colon that make this increasingly important after 60. First, intestinal motility slows. The muscular contractions moving material through your colon become less coordinated with age. Slower transit means longer exposure of the colon lining to harmful compounds, a process that compounds quietly over years. Second, the mucosal lining thins. The protective layer inside your colon loses regenerative capacity after 60. The cells lining your colon divide more frequently than almost any other cells in your body, which means more opportunities for replication errors and a higher baseline risk of abnormal growth. Third, the The gut microbiome shifts, research published in Nature Aging in 2023, following 9,000 adults over 65, found that the ratio of protective to inflammatory bacterial species shifts measurably after age 60. When that balance tips toward inflammatory species, the entire colon environment becomes more hospitable to the conditions that precede cancer. These are not small differences. They are fundamental biological changes that make what happens in your bathroom every morning genuinely worth paying attention to. So let me walk you through exactly what to look for and what each change means. Healthy stool should be brown, formed, and smooth, roughly the diameter of your thumb or slightly wider. It should pass without significant straining and leave you feeling genuinely relieved, not like you left most of it behind. That is your baseline. That is what functioning well looks like. The Bristol stool chart, developed by researchers at the University of Bristol and used in clinical practice globally, divides stool into 7 types. Type 3 and Type 4, smooth, sausage-shaped, easy to pass, represent optimal transit time and adequate hydration. You can search for this chart online and print it for free. Keep a copy inside your bathroom cabinet. This is not trivial. This is a clinical tool that gastroenterologists use. Having it available means you can communicate precisely with your doctor rather than saying something seems off. Now let me tell you what the deviations mean. Pencil-thin stool, consistently narrow, flat, or ribbon-like, is the warning sign that gets missed most often. People assume it is temporary, they drink more water and wait, but when stool is consistently narrow over several days, something in the lower colon is narrowing the passage. Sometimes that is muscular spasm, sometimes it is a mass compressing the colon wall from the inside. Here is the rule. If you observe pencil-thin stool on more than 2 occasions within a single week, call your doctor's office the next morning. Do not wait for your next scheduled appointment. Use these specific words: I am experiencing a persistent change in my bowel movements. Those words trigger a different protocol than a general inquiry. Black terry stool, the color and consistency of wet tar or coffee grounds, is a different category entirely. This is not a call your doctor situation. This is a go to the emergency room situation. When blood bleeds from the upper gastrointestinal tract, the stomach, the duodenum, it travels through meters of intestine before it exits. That transit time transforms it chemically. The hemoglobin oxidizes. What arrives is black, sticky, and carries a distinctive metallic odor. This appearance means you are bleeding internally at a volume significant enough to alter the appearance of your stool. The source could be an ulcer, a ruptured blood vessel, or a tumor. The cause matters, but not before you get evaluated. If you see black terry stool and you are not taking iron supplements or bismuth-based antacids, do not wait until morning. Go immediately. One distinction worth knowing: iron supplements and bismuth products like Pepto-Bismol can produce dark grayish stool. Blood-derived stool is different. It looks genuinely black and carries a shiny, sticky quality. If you cannot tell the difference, err toward caution. A false alarm in an emergency room is a minor inconvenience. A delayed response to upper GI bleeding is a life-threatening mistake. Bright red blood, visible on the toilet paper, coating the stool, or coloring the toilet water is more nuanced. The origin is almost certainly lower in the digestive tract. Hemorrhoids are the most common explanation, but hemorrhoids and colorectal cancer can coexist. You cannot determine the cause by looking. The only way to know is evaluation. Here is the clinical framework I give patients. 1 episode of minor bright red blood. No other symptoms. Call your doctor within 3 to 5 days. Recurring blood across multiple episodes or blood accompanied by changes in bowel habits. Call the same day. Blood accompanied by dizziness, unusual weakness, or significant fatigue. This is an emergency. Your body is signaling blood loss at a volume that is affecting your systemic circulation. Go to the emergency room. Diarrhea lasting more than 4 weeks is not a digestive inconvenience. It is a clinical symptom requiring evaluation. Possible causes range from infection to inflammatory bowel disease to microscopic colitis, a condition that is underdiagnosed in older adults and responds well to treatment when caught. Persistent diarrhea also drives deficiencies in B12, magnesium, and zinc, nutrients your nervous system and immune function depend on. Through constant nutrient loss before absorption can occur. Constipation lasting more than 2 weeks also deserves medical attention, not just dietary adjustment. Many common medications contribute to this. Blood pressure medications, opioid-based pain relievers, antidepressants, calcium supplements, and iron preparations. If constipation appeared or worsened after starting a new prescription, that is specific actionable information your doctor needs. Do not simply accept it as a side effect. You must manage alone. Now let me give you 5 specific concrete steps that research consistently supports for protecting your colon health. These are not general wellness advice. These are targeted, evidence-grounded actions. The first step is daily movement, and I want to be precise about what that means and does not mean. Your colon is moved by the same principle as a garden hose being squeezed from the outside. Muscle activity in your abdomen and legs creates external pressure that helps drive peristalsis, the wave-like contractions that move material through your colon. When you are sedentary, that external pressure disappears, transit time slows, exposure of the colon wall to digestive byproducts increases. A 2021 meta-analysis published in the British Journal of Cancer, pooling data from 52 studies and 4.6 million participants, found that adults who engaged in regular physical activity had a 19% lower risk of colorectal cancer compared to sedentary adults. The threshold that produced measurable benefit was not aggressive. It was 30 minutes of moderate activity, walking on most days. If mobility is limited, seated movement produces real benefit. Marching the legs while seated, chair yoga, arm circles, any activation of the core and lower body muscles creates some of the same mechanical stimulation. The goal is not athletic conditioning. It is intestinal activation. These are meaningfully different objectives, and the second one is achievable at almost every level of mobility. The second step is a specific dietary shift, not a comprehensive diet overhaul, but one targeted change. Processed meats, bacon, sausages, hot dogs, deli meats were classified as Group 1 carcinogens by the International Agency for Research on Cancer in 2015. That classification is the same category as tobacco. The mechanism involves nitrosamines, compounds formed when nitrite preservatives interact with proteins during cooking and digestion, compounds that directly damage DNA in colon cells. A 2023 review in the Lancet Oncology, examining 47 cohort studies involving over 800,000 adults, found that each 50-gram daily increment of processed meat consumption corresponded to an 18% increase in colorectal cancer risk. The protective side of this equation is fiber. Soluble fiber, the kind found in oats, beans, apples, and bananas, feeds the bacterial species in your colon that produce short-chain fatty acids. These fatty acids, particularly butyrate, are the primary fuel source for colonocytes, the cells lining your colon, and have direct anti-inflammatory and anti-proliferative effects on colon tissue. A large body of research consistently associates higher fiber intake with reduced colorectal cancer incidence. The target for most guidelines is 25 to 30 grams per day. Most adults over 60 consume less than 15. Practical translation: oatmeal at breakfast, 1 serving of beans at lunch or dinner, fruit with the skin on, and vegetables at every meal. These are not expensive additions. A large container of rolled oats costs under $4 and provides 3 weeks of breakfast. A can of black beans costs less than $1 and contains 15 grams of fiber. The dietary adjustment that matters most here is one of the most affordable ones available. The third step is maintaining your gut microbiome, and this deserves more than a mention of yogurt. Think of your gut microbiome as a living ecosystem, thousands of species performing different functions and depending on each other for stability. When depleted through unnecessary antibiotic use, chronic processed food consumption, or chronic stress, protective species decline and inflammatory species fill the gap. Plain yogurt with live active cultures introduces lactobacillus and bifidobacterium species, which have the strongest clinical evidence for reducing colon inflammation markers. Half a cup daily is the amount most research uses, but feeding those bacteria matters equally. Prebiotic foods, slightly underripe bananas, onions, garlic, whole oats, and legumes contain fermentable fibers that selectively nourish protective species. Without prebiotics, probiotic supplementation produces limited lasting benefit. The fourth step is knowing the parasite factor. This is something many physicians in the United States underemphasize, but research from the CDC estimates that approximately 60 million people are chronically infected with at least one intestinal parasite. Many have no dramatic symptoms, only fatigue, intermittent digestive irregularity, and unexplained nutritional deficiencies. Parasites compete for absorbed nutrients, generate inflammatory byproducts, and in some cases directly alter colon tissue over years. If you have pets, have traveled internationally, or have experienced persistent unexplained fatigue alongside digestive irregularity, raise this directly with your physician. A stool test identifies parasites. Treatment is typically a single, inexpensive course of antipyretic medication, well tolerated and effective. The fifth step, and the one with the single largest documented impact on colorectal cancer mortality, is colonoscopy screening. I understand the resistance. The preparation is genuinely unpleasant. The idea of the procedure creates anxiety. But here is the number that puts everything in perspective. A 2022 study published in the New England Journal of Medicine, following 84,000 adults over 15 years, found that colonoscopy screening was associated with a 31% reduction in colorectal cancer incidence and a 50% reduction in colorectal cancer mortality. Half the people who would have died from this cancer did not die because a colonoscopy found and removed a polyp before it became cancer. Medicare covers colonoscopy screening for adults 65 and older at no out-of-pocket cost under most standard plans. Between 50 and 64, with insurance, most plans cover it with no copay as a preventive service. If you are uninsured, most hospital systems have financial assistance programs. Cost should not be the barrier that determines whether you get this test. Here is what you now know that most people around you do not. Your body produces a readable health report every single day. The color, form, and consistency of your stool reflect what is happening inside your colon, your liver, your upper gastrointestinal tract, and your hydration status in real time. Most people never look. The ones who do and know what they are seeing catch problems when they are still solvable. You know the 4 warning signs that require action. Black, tarry stool, emergency room immediately. Bright red blood recurring or accompanied by systemic symptoms. Call your doctor the same day. Persistently pencil-thin stool across more than 2 occasions in a week. Call within days. Constipation or diarrhea lasting beyond 2 weeks. Medical evaluation, not dietary self-management. You know that daily movement, targeted dietary changes away from processed meat and toward fiber-rich whole foods, maintaining your gut microbiome, addressing parasites if relevant, and getting a colonoscopy are not vague lifestyle recommendations. They are specific evidence-supported actions with documented impact on colon cancer incidence and mortality. Here is your concrete action plan for this week. Tonight, search for the Bristol stool chart and print it. Put it inside your bathroom cabinet. Commit to 5 seconds of observation before flushing every day. Starting tomorrow morning, keep a small notebook in that cabinet, a date and a brief description, 10 seconds per day. It creates a record that makes your next doctor's appointment significantly more productive. This week, add oatmeal with fruit to breakfast, 1 serving of legumes to 1 meal per day, and plain yogurt to your shopping list. This month, call your doctor and ask directly about your colonoscopy history and current screening schedule. If you are 50 or older and have not had one in the past 10 years, schedule it. If you have a family history of colorectal cancer, discuss your specific screening interval. Let me tell you about a patient I worked with, a 71-year-old retired teacher named Margaret. She came in for something unrelated and mentioned, almost as an aside, that her stool had seemed narrower than usual for about 3 weeks. She was not alarmed. She thought it was diet-related. We performed a colonoscopy. We found a 2.4 centimeter polyp in the sigmoid colon, already showing early dysplastic changes. We removed it during the same procedure, no surgery, no chemotherapy, no radiation. A follow-up 6 months later showed clean tissue. Margaret is 74 now and sends a card every year. The 3 weeks she paid attention instead of dismissing the change are the 3 weeks that made the difference. That is not a medical miracle. That is early detection working exactly the way it is supposed to work. The system functions when the patient participates, and participation starts with observation. Drop a comment right now saying, "Aware, if this gave you something real today, if it answered questions you have been carrying quietly." I want to see that word in the comments. It tells me the information reached someone who needed it. Now think of one specific person in your life, a parent, a partner, a close friend who has been avoiding their colonoscopy for years, who would never bring up something like this on their own. Send them this video right now, not later. Right now. That single action might be more important to their health than anything they do this week. Subscribe to this channel. My mission is to give you the kind of honest, research-grounded health information that most people only discover after something has already gone wrong. You deserve to know it before that happens. In my next video, I am going to talk about specific foods that research links to accelerating intestinal inflammation, and 3 of them appear on nearly every healthy eating list. The evidence surprised me. You will not want to miss it. This video is for educational and informational purposes only. It is not intended as medical advice. Digestive health management must be individualized based on your complete medical history, current health status, and all relevant factors. Never adjust or discontinue any medication without first consulting your healthcare provider. Any persistent change in bowel habits, visible blood, or other symptoms described in this video warrants direct evaluation by a qualified medical professional. The information presented reflects current published research and should not replace a thorough clinical assessment.